Dr. Ramon Pink joins me now with the Canterbury District Health Board, just giving you public health update messages. Dr. Ramon, it's lovely to see you. How are you?
Oh, I'm very good, thank you, Megan.
Everything okay with you?
Everything's fine. We're safe as a family and we escaped structural damage to our house, so I think we're very grateful because I know it hasn't been the same for lots of people in the city.
And good to hear that your animals came home too.
The cat came back. I thought I'd lost him, but Sammy's at home again.
Fantastic.
So we're complete as a family again.
It's amazing to hear, actually. They generally have been staying away for about 24, 48, 72 hours, but they do come back, which is great.
Reassuring.
Now, some public health messages. I know that the main one that we all need to be extra vigilant about is the water situation. Indeed,
indeed. There's a lot of work going in by the public services to make sure that our infrastructure is up and running again, and obviously water is a real focus, but until we're clear about that, we really are reinforcing the need to boil water, particularly if you're drinking your water, if you're going to use water to clean your teeth or water to prepare food with, that water must be boiled. And when we say boiled, we were saying thoroughly, and people say, well, what does thorough mean? So
how thorough is thorough?
How thorough is thorough? So if you're boiling water on a stove top, for instance, at least a minute's boiling and then let it cool off. If you've got an electric kettle that flicks off on its own, put it through 2 cycles and you can be absolutely sure then that your water is going to be safe to use.
That's interesting to note, isn't it, as well, that with a jug and a kettle to do it a couple of times, if not 3, I've heard people say as well. So there's obviously a difference there from boiling it, bringing it to the boil on a stove to bringing it to the boil in a jug, which is something that we've learned.
Well, as someone said to me, boiling it anyway is better than not boiling it at all. And so I suppose the key message is to boil, but if people need parameters of what really is boiling, that's a good rule of thumb to go by.
And if you are unable to boil water for whatever reason in your home, if your power's still out, I heard, and you'll be able to tell me about this as well, a couple of drops of some household bleach?
That's right, yes. Just regular Genola off the shelf, 3 drops of bleach into a litre of water is going to be adequate. I don't think that there'll be too many people in that situation, but that will be safe to drink, and it will mean that it's almost a last resort if you want. Bottled, if you can access bottled water, of course that would be great, but if you can't get bottled water, if you can't boil your water, that's another alternative.
And do remember, as you've mentioned, we forget, we brush the old teeth and think that's going to be okay, and we're washing our vegetables and dishes and things. So just do be aware that there may be some problems there.
Indeed, and people have been ringing up about, if I buy a coffee from a cafe, is that safe for me to drink that coffee? And what we've been saying to the outlets is that they must boil their water. Some say, well, it's been through a coffee machine. That may be plugged into the mains and it may only come to 90 degrees. So we are trying to reinforce that message that boiling of the water before you serve somebody a coffee is ultimately going to be the safest for your customer.
Paramount too. Because we don't obviously want the spread of any gastro bugs, do we? Because they generally spread quite quickly. They like it.
They do, and so I think we have had a few cases of gastroenteritis in one of our welfare facilities, and so we've worked very hard to isolate those people that have been affected. And again, it comes back to good hand hygiene. If you don't have flushing water, you can't flush your toilet, we're giving instructions about how you can get rid of your waste that way. So in other words, the basic hygiene methods will prevent us from getting any gastroenteritic bugs. We're talking to primary care. Primary care is general practices around the city are pretty much up and running, and if people have any doubt and they're able to contact their GP, we're also trying to work with GPs to get a sense of is there an increase in gastroenteritis in the city, just to see how we are doing with that. But at this stage, I think the response from the public has been fantastic, and we just need to keep on pushing those basic messages around water and around hygiene.
If we do find that we're hit with a bit of a tummy bug until we can get to a GP or outpatients or something like that, what is something that we can do at home to make ourselves feel better and alleviate some of those nasty symptoms?
I think with gastroenteritis, our biggest, besides feeling terrible, and if you have some Panadol or something just to make you feel a bit better, but hydration is the important thing. Of course, and that comes back to, making sure that your water...
Vicious circle, isn't it?
It is a vicious circle, and of course that is a problem. So ensuring that you have good practice in terms of boiling your water, setting it aside. We're just boiling water, letting it cool down, and then filling up as many containers as we can find. And I think that if people can do that, that means you've got some extra water in store should you have gastroenteritis. And so if you do, hydration is important.
Very important.
Separating from the rest of your family members and just and trying to ensure that it doesn't spread in your family is really important as well. And so maybe isolating to one part of the house and just making sure that you're getting adequate, appropriate hydration will help alleviate that.
Fantastic, thank you very much. And just a quick note on hospital services as well. All non-urgent elective surgery has been cancelled today, which you'll know if that included you. Outpatient clinics are still running, however the advice is to the public to come in if you can, but if you can't get into the clinic, the DHB will be in touch to reschedule you at a later date. Dr. Ramon Pink, thank you very much.
Thanks.
Remember, any further details are available on the website as well, so do check that out. It is cdhb.govt.nz.